Hi, I'm Eilidh Duncan. I'm a research fellow at the Health Services Research Unit at the University of Aberdeen, and I'm grateful to be one of the first cohort of postdoctoral fellows funded by this institute. My fellowship research has focused on building the science of improving dental care. Dental services have been among the most disrupted essential health services by COVID-19 worldwide due to the high risks of transmission inherent in dental care. In the UK, all face-to-face routine dental care was suspended in March 2020, and dental practices moved to providing telephone triage, and patients requiring urgent dental care that could not wait were sent to designated urgent care centres. Dentists were told to operate on an advised analgesia and antimicrobial policy, and this approach was adopted across the globe. A return to face-to-face NHS treatment in the UK was not possible until 8 months later, in November 2020. This disruption has had significant impacts. Dental treatments dropped by 75% after COVID, representing a loss of 35 million appointments in the UK since the start of the pandemic. My fellowship research has explored what effect this has had to dental care and to how we go about improving dental care. I've done this through examining the routine data available on dental antibiotic prescribing and treatments, and through an online survey of all dentists in Scotland, distributed via NHS Education for Scotland. This has provided a lot of interesting data, of which I'm only going to be able to provide a flavour of just now. From my survey of 311 Scottish dentists, 54% felt that the overall quality of dental care had reduced compared to pre-COVID, and made it clear that COVID had impacted across fundamental dimensions of quality, including equity and efficiency. Dentists reported that the gap between quality of NHS and private care has widened, and here's a quote from a dentist that talks to this. There is now a well-established two-tier dental health system. With the NHS, they are provided a much higher standard of care. Dentists were also anxious about the extreme reduction in capacity to see patients and how this sits alongside the need to maintain access and tackle the backlog of treatments. Here's another quote from a dentist about this. We simply cannot see the number of patients we would like to see. Routine checkups are not an option. It feels like firefighting. As well as highlighting the impact on dental care quality, dentists also took the opportunity to share just how difficult things continue to be within the profession. They spoke of a loss of trust in the regulatory bodies and reported feeling a loss of professional autonomy during the pandemic. Looking at the routine data, it shows that dental antibiotic prescribing rates rose sharply during the pandemic to a peak of around 35,000 antibiotics prescribed in Scotland in the month of July 2020 alone. Although this dropped with the resumption of NHS treatment, it remains at a raised level compared to pre-pandemic. From the survey, most dentists reported being aware that their antibiotic prescribing had increased, and it was clear that there was concern and frustration about the increased use of antibiotics. Reducing unnecessary antibiotic prescribing is a key part of helping to tackle antimicrobial resistance, and that has been emphasised in pre-pandemic dental guidance and improvement efforts. Here's what one dentist had to say about the change in guidance. First, we are to reduce prescribing, and then we're asked to hand them out like sweeties. A striking theme within the data was the extent to which dentists felt they were prescribing antibiotics even when their clinical assessments did not suggest that they would be helpful, to satisfy the feeling that you had to do something for patients. And this did not sit well with them, with one dentist describing it as the way antibiotics were prescribed during lockdown was verging on criminal. The pandemic has taken a heavy toll on dentistry, and there continues to be significant difficulties to delivering good quality dental health care. These difficulties include the backlog of patients requiring treatment, reduced capacity, and the danger of widening dental health inequalities due to the differences in NHS and private care. These difficulties sit within a landscape of a lack of trust in regulatory bodies, feelings of reduced professional autonomy, and stress and worry. Any efforts to improve the quality of dental care will need careful tailoring and sensitive framing, but there does need to be renewed efforts, especially to optimise dental antibiotic prescribing. The increased dental prescribing of antibiotics may have an impact on antimicrobial resistance development, which is an area of increasing global concern. And as many of you will know, this week is actually World Antimicrobial Awareness Week. I intend to continue to explore how improving the quality of dental care continue and how we can reduce dental antibiotic prescribing during my final fellowship year and beyond. Thank you.